Welcome to the Montefiore Hospital. Most patients who visit our endoscopy department will follow a similar process, which we will show you within this video. When you arrive at the Montefiore, you will be greeted by our reception team, which will greet you and take your details and ask you to take a seat in the waiting area. Shortly after, you will be greeted by one of our portering staff, who will show you up to either our daycare unit or our ward. Once on the unit, you will be greeted by one of our nurses who will check you in, take vital signs such as blood pressure, pulse, temperature and oxygen saturations, and proceed to complete our endoscopy pathway. Please bring a list of current medications and allergies with you to give to the nurse. The nurse is also there to answer any queries you may have regarding the upcoming procedure. Once you've been seen by the nurse, you will change into one of our patient gowns. Shortly after, you will be seen by the consultant endoscopist, who is designated to carry out your procedure. This gives you the opportunity to ask any queries and for the consultant to discuss the procedure in depth and fill out a consent form with you. If you had opted for deeper sedation, you will also be seen by the anaesthetist consultant, who will go through everything you need to know about the anaesthetic. You will then be met by one of our endoscopy team, who will proceed to complete some safety questions and proceed to take you to our endoscopy room. When you reach the endoscopy room, you will be greeted by our endoscopy team, who will be with you throughout the procedure. Once in the endoscopy room, we will proceed to apply our basic monitoring such as blood pressure cuff, ECG leads and a pulse oximeter. And if you have opted for sedation, a cannula will be inserted. Prior to any procedure starting, the endoscopy team will carry out a safety checklist, making sure we have all the correct information to safely carry out your endoscopy. Once the procedure has been completed, you'll be taken back to either the daycare unit or the ward, where you'll be greeted by the nursing team. A full handover will be given from the theatre team to the nursing team. If you have received sedation, you would be expected to have someone with you for 24 hours before you can be discharged, so please make sure this is arranged prior to arriving at the hospital. Once you feel ready, you will be offered food and drink, and the nursing team will go through your discharge summary with you, making sure you have all the information needed once you leave the hospital. Once discharged, if you have any questions or concerns, please do not hesitate to contact us. Thank you for choosing the Montefiore.